Hi and welcome to Heal My Hemorrhoids. In this video you will learn how you can use your fingers to push out poop when constipated or have hard stools. So watch the whole video to the end to get all of the tips you need. Also, check the link in the description for a great way of dealing with constipation. Remember to hit the subscribe and like button if you like this video. There are several ways to mimic regular bowel movements if you're having problems with your bowel movement. And that includes several ways you can do it, and they all have both advantages along with disadvantages. If you're having a bad bowel movement system right now, you probably won't need to worry about it at all, since most people will be able to have regular bowel movements within a few weeks or so and things get normal like before. If the muscles in your anus can't properly stimulate passing stools, you can use fingers inside your anus and stimulate the bowel movement, and it'll cause the bowel to be pushed. This method is also used by people who cannot use the muscles in their lower body or have severe constipation. Even hemorrhoid patients can use this method to stimulate the bowel movement for temporary relief. Even if that's not the case, you can use other methods too that include taking fiber intakes or, better yet, laxatives. Laxatives can be very helpful against bowel straining, and they get rid of constipation, which is one of the main purposes for them. Now there are some health issues if your problems with constipation stay for a bit too long and you develop other conditions along the way. Conditions like hemorrhoids, which isn't a deadly condition but it's very irritating and serious issues that pretty much any adult can have. When you have constipation and you want a quick relief right in the toilet, there are certain things you can use, including changing your sitting position among other methods as well. Click on the link in the description for constipation help. But we'll be talking about one single method that's been used a lot by people with constipation or people with hemorrhoids. If the muscles in your anus can't properly stimulate passing stools, you can use fingers inside your anus and stimulate the bowel movement, and it'll cause the bowel to be pushed. This method is also used by people who cannot use the muscles in their lower body or have severe constipation. Even hemorrhoid patients can use this method to stimulate the bowel movement for temporary relief. The technique is fine by itself, but it shouldn't be overused like anything else, and if you're having a constipation problem or hemorrhoids, you should just take the proper treatment to deal with it. Using fingers to help pooping. It's easier to poop when you are sitting down, and that's the way your bowel moves easily. But everyone can't poop properly because of a lot of reasons that include constipation and even hemorrhoids. There are a lot of different methods to take care of these conditions, but one among them is using fingers to stimulate the bowel movement. The method itself may sound very unpleasurable event and disgusting as well. But this particular method is pretty effective in a lot of cases. And it certainly helps you to poop without putting strains on yourself too much. The bowel movement stimulation happens because of the pelvic floor that includes muscles and tissue at the bottom. The important part is that both men and women have a pelvic floor, so the technique can be done by almost everyone. To have a natural bowel movement, your anal muscles need to be relaxed to allow a good bowel movement, and it's even more of a problem when you have issues with stress or worse, hemorrhoids. Even if your stool is soft and formed but it still gets hard to pass, it needs extra help, and using fingers can do just the thing. If you're using this method and it doesn't work, that means you may have a problem with your rectocele and need additional treatment. But it sure works on most people, but it should only be a last-line issue-solving method, since it might be disgusting for a lot of people out there and not everyone can do it on the first try. Is it bad to pull poop out? If you're using this method way too frequently, it might be bad for the anus. It's often thought of as a safe practice, but only should be used when there is no other way you can relieve yourself at a moment. But it can be very harmful if you have severe cases of hemorrhoids or broken skin around the anus, since this can cause extreme irritation around the anus. Or else it can be pretty painful for people and obviously not recommended for this kind of issue. Pulling out poop can cause problems in the long run. If you're too much relying on this method for relieving your constipation, it is recommended to get a physician's help and get proper treatment, since it can cause problems in the long run. Using the method too frequently can cause the pelvic floor to bulge occasionally. It kind of is a path of a somehow smooth bowel movement. But it's always recommended to get proper treatment and address the issue to your physician clearly. First of all, you'll need your physician to take a good look at your current health issue, since the first thing you'll need is to soften your stool. That includes several other things to look after, including changes of lifestyle along with changing eating habits as well. If the condition is severe, your physician can start an aggressive treatment method if all else fails. Pushing on the perineum to pass stool. Now, this method works better in women because of the perineum pushing. It's also called splinting. It's done by inserting your clean finger in the vagina and pushing poop with your fingers from the inside by pushing the wall between vagina and rectum. The wall is called the perineum and it helps you stimulate a better bowel movement. Now, for obvious reasons, you can't use this method if you're a male. This method is widely used in women, and about 30% of them use it to relieve constipation. It even becomes popular because of a related TikTok trend. This method does seem undoubtedly unorthodox. It's a very practical way that you can use to relieve your constipation. It even does a better job, especially for people with problems with the pelvic floor, including pelvic floor dysfunction. Why you get constipation? We all know that constipation can be caused by almost countless reasons, and the treatment for them also are a lot different in numbers. But only a very few cases of constipation is caused by the pelvic floor, and it's pretty important to work with your physician to determine the actual reason. So it can be treated the proper way and not the other way around. This particular method isn't just for constipation patients, it's also a good solution for people with dysfunctional muscle groups. It can also be recommended by physical therapy providers, and there are multiple ways it can be worked with. It can be used from step stool or even with the squatty potty while you're using the toilet. Can't push poop out if constipated. To talk more about the splinting method, we'll have to know about the pelvic floor where it works. This includes the tissue and muscles of the bottom side, which is there to support the bladder and the bowel as well. Now, both males and females got pelvic floors, but there are size differences. A woman's pelvic floor is larger compared to the male one because it works to accommodate the birth canal, and that's a major point on using the splinting method. Also, see the link in the description for constipation help. Side effects of passing stool using fingers. Now, there are some serious problems you can face if you continually use splinting method. It can cause vaginal prolapse if not done carefully, which means the walls of the vagina drop toward the vaginal opening. And when the wall between the rectum and vagina bulges inside, the prolapse happens, and it's called rectocele. It mostly happens because of pelvic floor injury or due to misusing the splinting method to deal with constipation. So, in other words, the side effects shouldn't be taken lightly either. It can be used several times, but taking a physician's help is always recommended in the long run to avoid such injurious events. Rectoceles can be seen in women as a result of pelvic floor injury which might have come from giving birth. But it can also be caused by too much straining while pooping. And it doesn't just happen in one day of a wrong thing. It happens if you have been tolerating straining for far too long and it has become chronic. And obviously, that includes chronic constipation, and that's why it shouldn't be taken lightly. But just because you have constipation and you can use the splitting method, doesn't mean that you always should. Also, it doesn't mean that you'll have rectoceles for sure. It's just a precaution you should take because it's always better to be safe and get the proper treatment from your physician. If someone has non-relaxing pelvic floors, it can surely help you overcome constipation by taking care of pelvic floor tightness. It'll allow passage of stool pretty normally without causing any kind of fatal side effects. If somehow you have unrelaxed muscles, it'll be harder for bowel movements to happen properly, and that's why doing sprint can help you relieve the strain and work great to move your bowels. But of course, just because you can do it doesn't mean that you should keep using it as a somewhat permanent method of taking care of constipation. That's why it's always better to have a professional help you with your condition and get treated accordingly. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. I hope the video was helpful for you. For more articles and videos, go to healmyhemorrhoids.com or this YouTube channel.